Hello friends, I'm here with another video. Today, I will be talking about autism. Through my years of teaching and my knowledge, my experience, whatever I have learned about autism and the symptoms, I will try to answer the basic questions that comes to everyone's mind. So the first question, that is, what is autism? Autism or ASD, Autism Spectrum Disorder. It is a neurological and developmental disorder that affects how people interact with others, how they communicate, how they learn, or how they behave. Now, autism, it refers to a broad range of conditions which are characterized by some challenges which they face with their social skills, with their repetitive behaviors, speech, or they might be nonverbal communication too. So, autism, how does it look for everyone? Is it same or different? So, autism looks different for everyone, and each person with autism, they have a distinct set of strengths as well as challenges. Some can speak, others are non-verbal or minimally verbal and communicate in other ways. Some have intellectual disabilities while some do not. Some may require significant support in their daily lives while others may need less support. And in some cases, they might live entirely independent. So there are the other, like it looks different for everyone. Now, the next question is that is there any medical condition along with autism? Now, with autism, sometimes it comes, we might get uh, ADHD. Then there are other conditions that might also be there with autism. So, autism can come with other medical conditions too. Now, the triggers. If you see a autistic person, what are the triggers? So, space, some autistic people, they get overwhelmed when there are too many people or it's too crowded. Lighting, if there is any bright light, that may be a trigger. Too loud noises or something like, or somewhere which is too smelly. Sometimes touch, sometimes change in their routine. Little things matter a lot for them. So then next is the signs of autism. So what are the signs? First sign is not responding to their names. When they are young, mostly autism, whether a kid is autistic or not, we come to know within their 18 to 24 months of age. Some might know after 24 months of age. So, one thing that is not responding to their names. Another would be the eye contact. They would avoid eye contact. Then, not smiling when you smile at them, or getting upset if they do not like certain taste, smell, or sound, or any little change in their routine. Maybe they like to wear a particular type of shirt or a particular type of dress. Maybe it's like there are like some little things that are they are very specific and very rigid on it, and if there is any change, then they become upset. Then repetitive movements like flapping their hands, flickering, like flicking their fingers, or rocking their bodies, clapping. Not talking as much as other children due to their social difficulty, like difficulty to socialize. It's difficult for them to make friends too. So these would be some of the signs of autism. Now, next question, which many people think like, can an autistic child speak normally? So, yes, some are there who can speak normally. You wouldn't even know. They just speak fine. And then some would need support in areas of communication or fluency or pragmatic language. So, these are the things. Now, is autism a disability? Yes, autism is a neurological development disability. If a child has autism, and it is a disability, and that is always supported by the ISD after the diagnosis of the child. Now, the next is that what are the causes of autism? So, mainly, according to the studies and research, there are still going on. It's not clear, but genetic. It is the genes, genetic, like the rare gene changes, that is one of the most common cause. And then there are other environmental factors too, like air pollution or maybe low birth weight or stress or mother's lifestyle. All these contribute to autism. The next question is there any cure for autism? Now, there is no cure for autism spectrum disorder. One very important thing which I would like to convey in this video: autism is not a disease. I have seen many people, like, if I was not a special ed teacher and I wouldn't have interacted with the kids and studied about autism, gained my knowledge from teaching, I would have thought the same thing. So it is not a disease, it is a condition. It is not like you get like a flu or tummy upset, or something like you take medicines and then it's gone. No, it is not a disease, it is a condition. Now, is there any link uh, between like vaccines and like autism? So one thing which I have heard many times, that vaccines, like, my child got this so and so vaccine and now he's autistic. This is one of the greatest controversies, okay? And despite of extensive research, no reliable study has shown a link between autism spectrum disorder and any vaccine. So it is not caused by vaccine. If any parent avoids their childhood vaccine for their kids, then there can be danger of other things like catching and spreading serious diseases, including whooping cough or measles or mumps. So it is not because of vaccination that a child gets autism. Now, another thing is that um, complications regarding a child. Yes, there are complications with an autistic child. They will have problems with social interactions, communications, and behavior that might lead to difficulties for them, like problem in school, with successful learning, then employment problems, inability to live independently, or, social isolation because they have difficulty in socializing, so they might suffer from social isolation, stress within the family, they might be bullied. So these are some of the complications, and a child with autism, first of all, would need the support of the family. The family first needs to understand that, yes, okay, the child has autism, the child needs help, the child needs support. I know it's easier said than done, but support is the only thing. Support, love and care. And then another thing is that can autism be prevented? Like, is there anything we can do that we can prevent autism as parents? No, there is no way to prevent autism spectrum disorder, but there are treatment options, you know. If a kid is diagnosed earlier and there are different interventions that is helpful and it can improve the child's behavior skills, social skills, language development, but it can, like, okay, if the child has not received any of the intervention in the childhood, then there is no age limit, but sooner is better. And the child usually do not outgrow autism spectrum disorder symptoms. They will not outgrow. It will not be like at certain age, okay, now the child is not autistic. No, but with proper guidance, support, love, care, and interventions, therapies, the child may learn to function well. Okay, so this is very important, you all. In this video, my most important message to everyone here, whoever will be watching my video, is autism is not a disease. It cannot be cured by any medicine. Yes, if there is anxiety or stress or ADHD or other conditions along with autism, the person can take the medicines and those conditions can be in control. But it will never be that you take medicine and autism is gone. No, it will not go. But with proper support, intervention, love, care, and therapies, the person will learn to function well. So, to everyone, অটিজম কোনো ডিজিজ না, এটা হচ্ছে একটা কন্ডিশন। প্রচন্ড ভালোবাসা, সাপোর্ট, ইন্টারভেনশন, থেরাপি সবকিছু দরকার একটা বাচ্চার। তারপরে সেই বাচ্চাটা শিখবে কিরম ভাবে ফাংশন করতে হয়। ফ্যামিলি ইজ দ্য স্ট্রংগেস্ট সাপোর্ট ফর এনিওয়ান। So this is all for my video. If you know anything else, if you have more knowledge about autism, causes, treatment, anything, please share in my comments and definitely share with the ones who would benefit from my video. Bye for now. Thank you.